intended use, typically physicians are allowed to prescribe it for anything. And the possibility of widespread off-label use, and some of it black market and off-prescription use of drugs by people by groups of people who have not been tested for the drug's safety and efficacy is, I think, a real serious concern. So overall, I think I wish Scott and his colleagues the best of luck. I'm looking forward to their success. I think that society generally will welcome it and should welcome it, but there are some issues to be concerned about. I'm done.
Thank you, Hank. Very interesting. Wes, would you continue? We have posted a written comment by you to the live discussion page earlier this morning. And you can either recap some of this because your comment was so recent or expand on it.
All right. Well, thanks very much, Gabrielle. I'd be happy to continue. And I very much appreciate all the comments that have been made by both Scott and Hank. And again, thank you very much for organizing this because it's certainly a very interesting issue. The one thing that I want to go right back to is the issue of what is normal aging versus pathological aging. And I think that there's a real fundamental issue that needs to be understood here that I don't think that most people, even in the field of gerontology, really appreciate, which is the Gompertz law. The Gompertz law basically says that between the ages after maturity, that across all species, the risk of dying doubles every set numbers of years, and this applies, to all animals, and it applies mostly to plants as well. And it's basically due to a fundamental characteristic of living species that we're all